Hi, everyone. Welcome to the virtual program, National Radon Action Month, presented by the Missouri Lung Cancer Coalition. My name is Rebecca, and I'm the Manager of Adult Services at St. Louis County Library. I'd like to share some brief information before we begin. We're live right now, and this program is being recorded. This is a webinar, so we cannot see or hear you, but you're welcome to submit questions and comments in the chat box. They'll be addressed at the end as time allows. Also, this program is being captioned. To show those captions, you can click the CC button on your Zoom panel near the chat box and select Show Subtitles. Stay tuned for more great programs from St. Louis County Library, including the Winter Reading Challenge going on now. All ages can participate. You can register online with Beanstack, and you can pick up a print log sheet at a branch if you want. Complete at least 5 activities to be entered into an electronic prize raffle for prizes like gift cards to QT, Schnucks, and Amazon. Those are the adult prizes. We do have a virtual sign-in sheet and a survey for this program. Thank you so much for filling them out before you leave today. Now, I'm happy to introduce one of today's presenters, Rachel Sanford, Manager of Health Promotions at the American Lung Association in Missouri. She will introduce the other panelists here with us tonight. So thank you so much for being here with us today, Rachel. I'll let you take it away.
Thanks, Rebecca. I am just going to pull up my slides. And look good? All
Looks
right.
good.
All right. So thanks, Rebecca, for the introduction. Good evening, everyone, and welcome to the annual National Radon Action Month workshop and panel discussion. January is National Radon Action Month, and our coalition is working to educate residents in Missouri on the dangers of radon and what you can do to protect yourself from exposure. 2026 actually marks our 5th year of our educational campaign to raise awareness of radon and related health risks. So thank you to the attendees for joining us this evening. As a thank you for your attendance, all attendees located in Missouri will receive free radon test kits. In order to receive your free test kit, you will need to visit the Missouri Department of Health and Senior Services free radon test kit link, which will be shared both at the end of tonight's program as well as in the follow-up email. And for those of you joining from outside of Missouri, if there are any folks, we'll mention different ways that you can get a radon test kit or find a professional to do radon testing throughout our program tonight. And this evening's program will feature several panelists. We'll cover the panelists' bios later in the program, and you'll have an opportunity to hear more about their work as well as ask them questions. Our panelists tonight are Wes Hodgson of the Indoor Environments Association Heartland Chapter, Dr. Kevin Everett of the University of Missouri School of Medicine, Heidi Naffman-Onda, co-founder of the White Ribbon Project, and Misty Phillips, also with the University of Missouri School of Medicine. Before we review the agenda for tonight's program, I'd like to briefly cover the purpose of Radon Action Month. So the aim of National Radon Action Month is to increase public awareness of radon, promote radon testing and mitigation, as well as advance the use of radon-resistant new construction practices. We encourage everyone to take action and learn more about the facts about radon. We'll begin by covering some basic information about radon, and following the radon overview, we'll have a panel-moderated discussion, and we'll conclude with a Q&A session where attendees can ask the panelists any remaining questions that we have time for. If there are any questions we do not get to during the program, we'll make sure to follow up with attendees promptly and provide detailed answers. All right, so let's jump in. What is radon? Radon is a radioactive Class A carcinogen, meaning there's enough data to conclude that it can cause cancer. Radon is colorless, tasteless, and odorless, and when inhaled, radon particles become trapped in your lungs. Over time, the particles break down and damage the lung tissue and alter the DNA of the cells. Radon is the leading cause of lung cancer in people without a smoking history and the second leading cause of lung cancer overall. Radon-related lung cancers are responsible for an estimated 21,000 deaths every year in the US, and prolonged radon exposure is a serious health concern. Radon is a naturally occurring gas that is the byproduct of the radioactive decay of uranium found in rocks and soils throughout the world. Once formed, radon enters a home or building through cracks in the walls, basement, floors, foundations, and other openings, such as the water supply. As radon decays, it releases radioactive byproducts that are inhaled and can cause lung cancer. Because radon comes from rock and soil, it can be found anywhere, including both new and old homes and buildings. Many people think only old homes can have issues, but new homes that are sealed tight can actually trap radon even more. Exposure to limited concentrations, like those found outdoors, is impossible to avoid. However, when radon gets trapped indoors, it can exist in dangerous concentrations. An individual's probability or risk of lung cancer is based on both how high the level of radon to which they are exposed, as well as the duration of the exposure. Radon is so dangerous, in fact, that the Surgeon General issued a warning similar to the warning label that's placed on cigarettes. The American Lung Association, American Medical Association, Indoor Environments Association, the EPA, World Health Organization, and several other experts in health advise that elevated radon should be lowered. And while most Americans are generally aware of the danger that cigarettes pose and the link to lung cancer, they're often unaware of the deadly link between radon and lung cancer. Radon gas is measured in units referred to as picocuries per liter of air. According to the Environmental Protection Agency, or the EPA, the average indoor radon level is about 1.3 picocuries per liter. The EPA recommended action level is 4 picocuries per liter, and the ultimate goal is to get your radon level to the lowest level possible. Anything between 2 to 4 picocuries per liter indicates that action may need to be taken to reduce health-related risks. When we look at lung cancer statistics, lung cancer is the leading cause of cancer death in the US, claiming nearly as many lives every year as prostate, breast, and pancreatic cancers combined. In 2026, it's estimated that there will be just under 230,000 new cases diagnosed, and just under 125,000 people will die from lung cancer. Overall, the chance of a person developing lung cancer in their lifetime is about 1 in 19. And 20,000 to 40,000 lung cancers each year happen in people who never smoked or smoked fewer than 100 cigarettes in their lifetime. Lung cancer is also the leading cause of cancer deaths in women, surpassing breast cancer in 1987. And approximately 1 in 5 women diagnosed with lung cancer have no smoking history whatsoever. When it comes to lung cancer screening, the U.S. Preventive Services Task Force, or the USPSTF, advises that adults ages 50 to 80 who have smoked for at least 20 pack years and either currently smoke or have quit within the past 15 years should get an annual lung cancer screening with a low-dose CT scan. If this is something that you can relate to, or if you fall into these eligibility criteria, it's important to talk to your doctor to see if this screening is right for you. Unlike guidelines for smoking history and lung cancer screening, guidelines for radon exposure and lung cancer screening do not currently exist. Our teams work to advocate for lung cancer screening guidelines to be updated to include things like radon, secondhand smoke, occupational exposure to smoke and chemicals, but we have a great deal of work that needs to be done to ensure these are included. If you're exposed to radon, we recommend discussing this with your healthcare provider and detailing the level and duration of exposure to determine if a low-dose CT scan should be completed. Again, a radon level of 4 picocuries per liter, which is the EPA recommended action level, meaning that the home or building should be mitigated, is comparable to smoking 8 cigarettes a day or receiving 100 x-rays a year. And when we look at radon in smoking, radon exposure coupled with smoking increases the risk of developing lung cancer tenfold. Radon levels as high as 285 picocuries per liter have been recorded in Missouri, which is equivalent to smoking over 40 packs of cigarettes per day when you're looking at the level of risk. Nationally, about 1 in 15 homes have elevated levels of radon. But when we look at Missouri specifically, there are about 1 in 3 homes in Missouri that have elevated radon levels. In Missouri, there are over 5,400 lung cancer cases annually, with an estimated 850 of those cases that can be attributed to radon. Missouri does not currently have any statewide radon policies that protect our residents from radon exposure or require professional training and certification. This is also something that our team is actively working on. As far as radon testing, radon can impact anyone, and the age, location, exterior type, and foundation do not determine if a building has radon. Every home and building should be tested for radon, and radon has been found at elevated levels in homes in every state. The only way to know is to test, and testing is recommended every 2 years because radon levels can fluctuate. We'll get into why this is necessary more when we move to the panel portion of tonight's program. Elevated radon also causes no symptoms until lung cancer symptoms begin. As far as radon testing options, you can hire a certified radon professional. The average cost of a professional radon test is about $140 to $200 and depends on the size of the home or the building that you're testing. You can also purchase a radon test kit from Alpha Energy, AirCheck, and other reputable labs and retailers. State radon programs, like our program in Missouri, may also have free or low-cost test kits available to residents. And as I mentioned before, following our panel, we will share QR codes and links where participants from Missouri can order their free test kits through our state radon program. We'll also share a general link for anyone who might be joining us from another state. So how is radon detected? The only way to detect a buildup of radon in your home is to test the air. Various forms of do-it-yourself test kits and digital detectors can be both simple to use and inexpensive. However, if you prefer, you can also hire a certified radon testing professional. And the best way to find a certified professional is to either contact your state radon program or use the EPA's interactive map with contact information. As far as the types of tests that exist, passive test devices do not require power to function, while active test devices do. Passive devices include alpha track detectors, charcoal canisters, and charcoal liquid scintillation detectors. Active test devices include continuous monitors, and we'll talk a little bit more about these. Short-term tests typically take 2 to 7 days, but can sometimes take up to a few weeks for results. Long-term tests tend to be more accurate as they collect more data. They take at least 3 months and measure long-term averages. If you don't want to wait for a long-term test, short-term tests can indicate if your home has a problem and requires follow-up testing. When it comes to where and how to test, when you're testing, you want to place the test kit in a location where it will not be disturbed, in the lowest regularly used level of your home. So this might be your basement, or for those of you who don't have a basement, the first floor of your home, maybe a living room or an area where your family spends a lot of time. Follow the test directions and other official guidance to prevent problems that can affect the testing. Digital detectors can also be purchased for your home and can provide short-term readings as well as establish an average for the long term. Testing during any time of the year is fine, but testing during winter months will yield the most accurate test results since your home is closed up and the windows are not kept open, which allows outside air to interfere with the results. Knowing where and how to test is key when it comes to radon. Do-it-yourself testing can be tricky, especially if you've never done it before. So the graphic here highlights some of the best practices for using radon test kits. As you can see, you want to keep it away from heat, drafts, and humidity. Make sure that it's a certain distance away from an exterior wall, from any outdoor openings, above the floor. Avoid things like direct sunlight or placing the device on stone surfaces. So you really want to make sure you're careful when you're using a do-it-yourself test kit. If your do-it-yourself test kit shows elevated levels of radon, it might be a good idea to hire a professional to do testing to confirm that level before you move towards taking action. So how do you protect yourself from radon? If you have an existing home with elevated levels of radon, you can fix the problem by having a radon mitigation system installed. A radon mitigation system consists of a vent pipe, fan, and the proper sealing of cracks. The system collects radon gas from underneath the foundation and vents it to the outside of your home. If you need to have a radon mitigation system installed, we recommend you contact a certified radon mitigation professional to do the installation. A list of certified professionals can be obtained by contacting your state radon program. Even with a mitigation system installed, radon testing still needs to occur every 2 years. If you purchase a continuous monitoring system, please note that there is not enough data for the National Radon Program to verify the effectiveness of these devices. You always want to make sure to purchase a quality device from a reputable company, not just the cheapest device that's available on Amazon. And these monitoring systems, like smoke detectors or CO monitors, have a lifespan and need to be replaced periodically. These devices also need to be used as instructed. So, for example, they need to be placed in one location and not move throughout the home, as moving the device will create unreliable results due to averaging tests from different rooms. Continuous monitoring system results also need to be verified by a professional or lab testing at that same 2-year frequency. Mitigation systems, just like any other system in your home, think about your furnace or your air conditioner, need to have regular maintenance. Radon mitigation systems work and can help prevent lung cancer. When it comes to building a new home, you may want to ask your contractor to install radon-resistant features. These features include gravel and plastic sheeting below the foundation, along with proper sealing of cracks and the installation of a vent pipe. Once the radon-resistant features have been installed and the home is completely built, you still want to make sure to perform a radon test, as the levels could be elevated. If the radon levels are still elevated, a radon fan can be added to the system to lower the level. Please feel free to put any questions that you have in the chat that have come up during the overview. I see that there are already some coming in. We'll move on to our panelist portion of the webinar now, and all questions will be addressed during the Q&A portion at the end of tonight's program. Our first panelist today is Wes Hodgson. Wes is a second-generation radon and building science specialist with over 30 years of industry experience. He and his team at Midwest Radon have completed nearly 30,000 radon measurement, mitigation, and vapor intrusion projects across the region. A longstanding member of ARST IEA, which is the Indoor Environments Association, Wes currently serves as president of the Heartland chapter. He holds NRPP certifications in radon measurement and mitigation, and is a certified soil gas mitigation compliance inspector, reflecting his commitment to advancing industry standards and protecting public health. Thank you, Wes, for joining us this evening.
Thank you, Rachel.
All right, so for our first question tonight, what do you do if you have high levels of radon, and how do you mitigate it, and how much does it cost on average to fix the problem?
So just as you had briefly described in a previous slide, obviously if radon test levels are above 4 picocuries, EPA guidance is to mitigate the home or building. And that's done by installing a radon mitigation system, sometimes referred to active soil depressurization, or ASD. In general terms, what this system is it's a vent system. In most homes, what this entails is drilling a hole in the basement floor to access the gravel or the airspace that's below the basement floor. Whereas then you insert a pipe into that airspace, that pipe gets routed up and out of the home in some fashion. It varies a little bit from home to home. It's in most cases a bit of a custom installation. But there's a fan in line, an enclosed inline fan that's installed on this vent piping. And the idea here is that the fan runs continuously and draws soil gas, radon, from below the home and safely exhausts it outside and reduces the radon entry into the home and the concentration. In terms of costs and things like that, it can vary from home to home. Within the industry, we like to say that the average cost for installing mitigation systems typically starts somewhere around $1,200, give or take. When choosing a contractor, it's important to make sure that they are certified nationally. Missouri, as you'd mentioned, Rachel, doesn't currently have a certification or licensure program for radon measurement providers or mitigators. However, there still is the national certification, which is the National Radon Proficiency Program, NRPP. It would be important to search those lists for a qualified contractor to install the system. Their website is nrpp.info, and so you're able to easily get to that list within your state at that website. In terms of those costs, again, they can vary. It's simple to say that that's the average, but certainly some homes can present challenges that might inflate that cost.
What about if somebody lives in a rental property or an apartment building?
Well, I would still recommend testing. Unfortunately, in Missouri, there is no requirement for landlords to do any testing. So the building may have never had a test performed on it. Just as you had mentioned, the most cost-effective way for a person to do a test is to pick up a home test kit, be it through the state or online, ordering it directly from a laboratory. In most cases, you can pick up a home test kit for $20 or less, deploy that. In terms of if that test was to come back high, obviously that would be something that a tenant might then approach their landlord or the owner of the property about the potential health risks. It might require some education on their part to educate the landlord or the homeowner, but see if there's a way to remedy the problem with them. Unfortunately, again, in Missouri, we have no legislation that requires mitigation in buildings for tenants. There are a number of states, just there in Illinois now, since last year, required that if a radon test was to come back high in an apartment or a rental property, the owner would not be required to fix it, but they also could not essentially punish the tenant for wanting to move out of the property early. There'd be no consequence for them to leave the property earlier. And that's relatively new legislation that's happening in various states.
Definitely something that we'd like to see happen in Missouri too, I think.
You bet.
When you're looking at a home or a building, what areas tend to have the highest concentrations of radon and why?
Generally, it's going to be the lowest portion of the building, whether it's the basement or if it's a slab on grade, that lowest portion of the building that's in contact with the soil. In most buildings, that's where you will find the highest concentrations. Two reasons. One being that you're obviously closer to the source, you're closer to the soil. And so as the radon enters into the building, that's where you will find the highest concentration of entry. But radon often it's slightly heavier than air, so it does make its concentration higher in the lower stories of the building. Typically, we expect about 1/2 to 1/3 the concentration as we travel up each story in the building. So if we were at 10 in the basement, it wouldn't be uncommon to see something more like 5 to 7 on the first floor, and then even less than that by the time you get to the second floor of the home.
What about new homes? If somebody has a new home with no noticeable cracks or gaps where radon can enter, why do they still need to test their home?
Still important to test because anything that is attached to soil can potentially have concentrated levels of soil gas, a la radon. And so there is no way to look at a home or evaluate its construction or evaluate its deterioration in the form of cracks or openings in the slab and make the determination that that home would have high concentrations of radon. There is literally no way to know until you've done a test.
And then last question, can you speak a little bit more about why testing needs to be done every 2 years?
Sure. Yeah, that's been the EPA guidance for quite some time. It's primarily because radon levels can change. For instance, we see seasonal fluctuation in most buildings, whereas the heating season might produce higher concentrations than what we see during the spring and the summer. This is all relative to the stack effect, basically warm air in the home rising. And as that's the primary driving force for radon entry is that warm air rises, escapes the roof line, that creates a negative pressure or a vacuum inside of the building, and that begins to pull air in from obviously around cracks, around windows and doors. That's how we get air exchange in most buildings. But that same driving force or stack effect is also what causes predominant cause of radon entry into the home. And so it's a good idea to perform that test. Even if the initial test was below 4, it's good to do a follow-up test a couple years later to make sure that that test, one, wasn't flawed, and two, to make sure that the radon levels haven't or concentrations haven't changed over that period of time. The soil changes around the home over time. That can produce slightly different input rates or intake rates of radon into the home. And so it's a good idea to always kind of set up a curriculum to do that test every couple of years, just to ensure that nothing has changed.
All right. Well, it looks like we've got a pretty active chat, so I'm sure there will be some more questions for you at the end, but thanks again for joining us this evening, and we'll move to our next panelist for now.
If you don't mind, I will answer one quick question that I saw come across, and that was, I think someone had asked about what could cause the second floor to have the same radon concentrations as the first floor or even the basement. And that is that, particularly as we're here in the middle of winter months, oftentimes, particularly in newer homes, the HVAC system can be a driving, well, in any home, the HVAC system can be a driving force for radon entry too, because it creates a negative pressure. But also that HVAC system is often located in the basement, where the radon concentrations are at their highest most often. And so with increased HVAC activity, that distribution of basement air is increased. So we often see that the basement air is then driven up to the first and second floors of the building. So during the middle of winter, and then again during the middle of summer, when we have that increased HVAC activity, that's when we start to see the difference between basement and first floor begin to shrink, because we're getting a higher amount of distribution of basement air into the home.
All right. Well, we'll look forward to having you answer some more questions in a little bit here.
Fantastic.
All right. Okay, so our next panelists for the evening are Dr. Kevin Everett and Misty Phillips. Kevin is Associate Director for Prevention, Control, Outreach, and Engagement at the Ellis Fischel Cancer Center and Research Director of Family and Community Medicine at the University of Missouri School of Medicine. He has over 25 years of experience leading tobacco control and cancer prevention initiatives with a focus on youth prevention, cessation, and community-based interventions across Missouri. Misty Phillips is Manager of Research Activities in the Department of Family and Community Medicine at the University of Missouri School of Medicine. Misty has more than 20 years of experience in public health and cancer prevention and currently serves in leadership roles with the Missouri Cancer Consortium, advancing cancer prevention initiatives statewide while also pursuing her PhD in population and precision health. Thank you, Dr. Everett and Misty, for joining us this evening.
Our pleasure.
All right, so first question, can you talk more about the lung cancer risk for tobacco use and radon exposure combined?
Well, sure. As was mentioned, smoking is the leading cause of lung cancer. And so if you are a smoker and then also exposed to radon, there's sort of a synergistic or interactive effect that increases risk. So for a population of smokers, about 62 of those out of 1,000 will die of lung cancer, compared to 7 people out of 1,000 for a never smoker. You could think of it as another way where a person who never smoked and is exposed to the 1.3 picocurie per liter of radon has a 2 in 1,000 chance of a lung cancer, while that person who is a current smoker or has a lengthy smoking history, they'll have a 20 in 1,000 chance of dying from lung cancer. And lung cancer with smoking is related to quantity over time. And as you mentioned, similarly, that the higher the level of exposure to the radon over time is also a risk factor.
And can you reiterate for our attendees the eligibility criteria for lung cancer screening?
Sure. So it's recommended for those who are between the ages of 50 and 80, and they have a 20 pack year history of smoking. And a pack year means that you would have smoked a pack a day for a year for 20 years. That's a 20 pack year history. It could also mean that you smoked 2 packs a day for 10 years and you would have a 20 pack year history. And that recommendation is for those who with the pack year history who currently smoke or who quit within the past 15 years.
And what percentage or number of people are eligible for lung cancer screening, and how many of those are actually being screened?
I can answer that one, Rachel. So national estimates actually for the United States suggest that about 12.8 million people are eligible based on the U.S. Task Force guidelines, with only about 19% who are actually screened. And then here in Missouri, it's about 19.2% of people who are considered high risk for lung cancer actually get screened with that annual low dose CT scan. And that rate is roughly on par with the United States average, which is about 18.2%.
And what about if somebody is concerned about their lung cancer risk, but they don't meet those eligibility criteria for screening?
Sure, that's a good question. Really, we try to promote people to always going back to their primary healthcare provider. They always want to check in with them about their own personal risk, whether it be family history, any radon exposure, any occupational risks that they may have had. So that way they can do some risk reduction steps, such as Dr. Everett has mentioned about smoking cessation and possibly, again, doing that radon testing are strongly recommended. And then, of course, any symptoms should always promptly be evaluated by their physician as well.
And what about lung cancer survivors? Why should they be especially concerned with testing their homes for things like radon?
Sure. So with a lung cancer diagnosis, testing at home for radon should definitely be a priority. That way they can ensure that there's not a high radon level in the residence. Radon remains a lung cancer risk even after treatment. Survivors, they could be more vulnerable to a new primary lung cancer. And so that radon testing and the mitigation strategies are just simple steps to help reduce ongoing risk for both the survivors and the folks in their households as well.
Thanks, Misty. And then for Dr. Everett and Misty, is there anything else that you want to add about lung cancer screening or tobacco cessation?
Yeah, I never want to miss an opportunity to let people know that quitting smoking is probably the best thing anyone can do for their health. And in Missouri, we have a quit line services that the Department of Health and Senior Services oversees. You can call that number, 1-800-QUIT-NOW. They have a multiple series telephone counseling, text to quit, just a lot of services. They're free, and there are oftentimes opportunity to get free nicotine replacement when you use that. So, other additionally, most local health departments have somebody there who can offer you services to help you quit. And other health systems will do the same. I just really encourage if you're a current smoker to consider those options, and if you have friends or loved ones, to let them know of those services. It's just such a valuable thing to do for your health.
Thank you, Dr. Everett. All right, well, we will move into our next panelist for tonight's program, Heidi Nafman-Onda. Heidi is co-founder of the White Ribbon Project, which, if you haven't heard of it, is an organization dedicated to promoting awareness about lung cancer by changing public perception of the disease. Heidi is also a lung cancer survivor herself and was diagnosed with stage 3A non-small cell lung cancer in October of 2018. Heidi seeks to encourage other lung cancer survivors and advocates to mobilize their efforts to increase awareness about lung cancer, change the public perception of the disease, and work to help improve prevention, early detection, and treatment of lung cancer. Thank you, Heidi, for joining us this evening.
Thank you so much for having me this evening and to have the opportunity to share my story and hopefully save some lives here. Being a lifelong health enthusiast, health educator, and a fitness trainer, married to a primary care physician, my family and I were blindsided, our lives turned upside down by my stage 3A inoperable lung cancer diagnosis more than 7 years ago. The really scary thing about this was I didn't have any symptoms. This was an incidental finding while looking at another health issue, where a CT scan was, ordered for my chest, abdomen, and pelvis just to rule out something else. And what I got back was, you look really healthy, but you got this mass in the upper left lobe of your lung and some lymph nodes in the middle of your chest that look suspicious. Again, initially given no hope and told to get my affairs in order. Next slide, please. But I'm sitting here today, 7 years, 3 months out, because research matters. When I met my oncologist, I was given much more hope. I was told that, yes, I didn't have a targeted mutation that I could take a pill for or some other things that could have given me a better prognosis. But after chemo radiation, if I didn't progress, this tumor that you see under the 2018 sign there, if that didn't get bigger or if it stayed the same, I could get immunotherapy treatments, a new immunotherapy that had just been FDA approved about a month prior to my diagnosis. So that tumor that you see under 2018 just started melting away during the chemo radiation process. And then I did qualify for the immunotherapy. So as you can see on my latest scan in October of 2025, that tumor's gone. Everything in the middle of my chest is also gone. So thankful for research. I am no evidence of cancer at this moment, but that doesn't mean this story is over. I see this all the time. People are clear 5-10 years, and then it comes back with a vengeance. And this is kind of like a black cloud. I never stop worrying about this. And so next slide, please. These people here that you see are the most important people in my life. I never dreamt 7 some odd years ago that I would get to become a grandparent because of this diagnosis. Well, I have been. And then I have 3 adult children here who, I worry about. And how did I tie this to radon, you might be asking? Well, when we had to tell our 3 adult children that I had lung cancer, their heads were spinning. They grew up in a household where we ate very clean, we exercised. I never touched a cigarette in my life. But my son here, who you see there with the beard, he's an environmental engineer. And the first question he asked me was, Mom, what's the radon level of the house? And I said to him, I don't know what you're talking about. He gave me a quick education. We got the house tested. And, we were more than twice the level of what the EPA recommends. My son goes by World Health Organization standards at 2.7. So, sitting at about a 10, your graph over there said that I probably smoked 20 pack years in an equivalent. And I am not eligible for screening, and neither are all of my kids. And, people need to know to advocate. My children all range in the age from 30 to 37 years old. They don't meet the age requirement. They never touched a cigarette, but they did grow up in a radon infested house, which I lose sleep over every single night. So my message to you is, this is a risk no one needs to take. It's simple to test. Please don't guess that it's okay. It's simple to mitigate when you hire a professional. You should not be doing this yourself. And I love my continuous monitor. Yes, there are issues, but you know what? It lets me know when I probably need to test again. And we do that too. We test every 6 months. I'm not waiting 2 years. And I'll tell you why. We had our house mitigated immediately, got the level down, because I didn't want to go through treatment and then come home from treatments and be re-exposed to a carcinogen. So that was very important to me. But the other thing that's really important is things change. My husband has this monitor attached to an app on his phone. 2 years after we had our mitigation system installed, so not even a point, maybe close to retesting, right? We had this alert happen to my husband when he was across town. Suddenly, we were quadruple the level we had ever been. It was so high. And he called me and he said, is something going on at the house? And I go, yeah, we're getting like this horrible rainstorm. It's like waterfalls. He said, go in the basement and check. We had a little bit of water in the basement, but you know what we had around our mitigation pipe that goes through the foundation? We had mud totally backed up, and this system couldn't work. Had I been on vacation, or had we not had this alert system, I wouldn't have known, and we wouldn't have known to fix the radon mitigator. We called the mitigation service right away. They told us what to do. We opened windows, we got things dried out, and then they came and they helped readjust things and get things moving again. I really like having that system. It's another reminder to keep my family safe. Again, my message to you is, this is a risk no one needs to take. There are professionals that can help you fix this if you have a problem. And don't risk yourself, your health, or your family's. This story is not over for me. It never will be. It will never be over for my children either. Thank you for letting me share.
Thank you, Heidi, for sharing your story. We're so glad to have you with us for our 5th year of the program. Heidi was actually with us our 1st year, and we hope for many more to come. With that, we'll move into some state-specific radon information and how you can contact our program and get your free test kit. And then we'll move into Q&A. So make sure if you have any questions that you have entered those into the chat, or keep entering them as we go through this last bit of information. All right, so as far as the Missouri Radon Program, there is a website where you can find more information, learn more about radon. Obviously, we've had an hour for our program tonight, but there is so much more for you to learn. We also have a Missouri Radon dashboard that allows you to look at different counties across Missouri and the radon levels that have been reported through testing. And then we also have the Radon Program email listed here so that you can reach out with any of your questions. They are always more than happy to help you, help guide you through anything related to radon. And we'll also make sure to post any of the links in the chat or share them in a follow-up email. So it's time to take action and have your home tested for radon. Testing, like we've said multiple times throughout the program, is the only way to know if your home has elevated levels of radon. There is the free test kit program for residents in Missouri. So if you scan that QR code that says Missouri residents under it, you will be directed to that form. We also have a QR code for folks who are in other states, so you can explore the options as well. And then again, we'll make sure to post that in the chat as well as share that in the follow-up email. I'll give just a couple of seconds for everyone to scan that and make sure that they are pulling that form up and getting that ready to go. All right, and before we move to the Q&A portion of tonight's program, we'd just like to take a moment to recognize and thank our partners and our Missouri Radon Reduction Team members for their dedication to raising awareness around radon and the health-related risks of exposure. Thank you again to the attendees for taking the time to join us this evening. We really appreciate it. And with that, I will pass it back to Rebecca for Q&A.
All right. Thank you, everyone. All the panelists for the great information you shared, Rachel for taking care of the presentation, and everyone in attendance, especially the folks who have been asking questions. I know we just got a question. Can you please go back to the barcode screen? Rachel, do you mind bringing that back up real quick?
Sure, no problem.
And then I did add the links directly to the chat box as well, but sometimes it helps to have it on your phone. And right now you're in presentation mode, Rachel, so it's really tiny. I can see your notes, but it's hard to see. It's hard to see the QR code.
It looks like it just closed out. Is it still up for you or no?
No.
Okay.
I'm going to go ahead and re-add those links if that's easier. Get your free test kit. The links are in the chat box. And I will just go ahead and say to everyone in attendance, we'll be following up with everyone with a link to the recording, some of these really helpful links that were shared during the presentation, and certainly a link to like how to request that test kit. There. Okay.
There we go. Sorry.
No, you're fine. You're fine. So I'll just sort of mention that we've been getting a lot of great questions, and I apologize in advance if we don't get to every question, but we'll do our best here. So one of the first questions is probably a pretty common one. Like, I only go in the basement for laundry. Should I test in the basement or upstairs on the main level or both?
The best course of action, honestly, would be to test both. If somebody called me at the office today and asked that question, my recommendation would be to deploy a test device in both locations, particularly if it's a basement that you don't spend a lot of time in. Obviously, the areas of the home that we're most concerned with are the areas that you do spend time, because that's when the risk begins to compile.
Got it. Thank you. Thank you, Wes. Another question, probably for you, Wes. This person said, I previously reached out to a radon testing company, and they said that since we have like sort of like two portions of the house built at different times, 1925 and 1950, that you needed to perform two separate tests. And I assume probably some people in attendance, a lot more people may have the same issue with like expansions to their home. Is that accurate, or could one test be performed?
That's an accurate statement, and some of that obviously is dependent upon the size of the home too. Certainly, in expansive homes where one portion of the home is constructed over a basement and another portion of the home is constructed over a slab-on-grade addition, the radon levels could be vastly different in those two different areas. There's also this misnomer that homes constructed slab-on-grade without basements won't test high for radon, and that's absolutely false. As we mentioned earlier, if the building is attached to the soil, it can potentially have elevated radon concentrations.
Got it. Thank you. Heidi, I think there was someone in attendance that wanted to know, what is the alert system that you use? And then a broader question for everyone, like, what is a reputable brand for a constant radon monitor?
I was gifted from the radon, community an Echo Cube It's Echo Essence. I'm not sure. Maybe Wes could confirm the actual name. But I gifted them to my kids too. And again, it's not an absolute. It's just kind of an alert and a reminder. We can look on our phones at any time. You saw in my family photo, I have grandchildren. Their playrooms are in the basements of these homes. And my kids are very cognizant of what the levels are there. And some of them are close to zero. That's hard to get to, but it's a priority in our family, and we're scared.
The EcoCube
So-
is a great device. It's been out for several years now. This is a new market, an emerging market, consumer level electronic devices like the EcoCube. There's a lot of studies going on to determine which ones work and which ones don't. But I can say nationally, as we've done comparisons against calibrated devices, that the EcoCubes hold their own. So it's a good device.
Great.
And we
Good.
do use the time test too. So if we see something, we see a change. I mean, we're doing it every 6 months regardless. But if we say something else, we're calling our mitigation service to help us out. And we haven't had to do that since that one, in 2022. No, 2020.
It's for that reason, Heidi, that we often recommend these days, even after a mitigation system has been installed, for the homeowner to go ahead and purchase one of those EcoCubes on their own to monitor it. Sometimes that might be the first indication that the fan system has stopped working. There's required to have monitors installed on those systems that give an indication that the fan is active. But often you have to go to the basement and look in the corner at the pipe to determine that fan is operational. Whereas with the EcoCubes, you have phone connectivity, and when the levels exceed the EPA action level of 4, it's going to send you a notification, and sometimes that's the first indication that the fan system needs looked at.
Thank you. Thank you. A question just came in and I don't know the answer. So, Rachel, thank you for sharing the QR code for getting the free test kit. And we also added the direct links to the chat box. Someone asked, can businesses or like nonprofits utilize that free test kit option, or is that just for private residences only?
That is a great question, and I'm gonna double check and verify this myself at the link, but I believe it is for private residences only. I do believe that, if you have a question about that, you could absolutely reach out to the Radon program to verify that as well, but I'll try and look that up quickly while we're going through some other questions too.
Okay, sure. Wes, I know you mentioned like whether the fan is working in this mitigation system. If you already have a mitigation system, how can someone check to make sure that's working on their own?
So if the system was installed by a nationally certified, trained installer, it should have a system monitor installed on it. It's a little U-shaped gauge. This is just a pressure gauge. When the fan is operational, there's a negative pressure or vacuum inside of the vent piping. And the little U-shaped gauge gives indication that pressure exists because the fan is operational. These days, more and more installers are also installing an active alarm that chirps if the fan shuts off, which is great because there again, oftentimes these pipes are stuffed in the corner of a basement in the unfinished room where nobody's spending a whole lot of time. So the alarms that give that indication are a good investment.
Wonderful. Wes, I know you also mentioned the idea that like using HVAC systems, your basement air is then sort of transported into different levels of your house. So related to that, one attendee asked, will increasing the level of outdoor air intake on an HVAC system potentially lower radon levels? And maybe sort of related to that, what about opening windows?
Sometimes maybe, and we just don't know, is the answer to those questions. It's theoretically, yes, if you dilute the air down in the home, the radon levels will be reduced temporarily. but that's not the case in all homes. If you open the wrong window on the wrong day with the wrong wind pattern, by opening windows, you could actually increase radon levels in the home, radon concentrations in the home, because now you have outflow of air from the inside of the home that has to be replaced from somewhere, and that replacement air may be drawn up from the soil below. So it's not a true methodology for mitigating radon.
Got it. Another attendee asks more about that radon sample and like basically how the testing works. So once a radon sample is collected from one of these free test kits, who is performing the testing? Is it done by some like a state university or subcontracted out to some sort of commercial laboratory? That's a good question.
Depends on the type of test, but the home test kits that we've referred to a bunch through the program here are generally going to be returned back to a nationally accredited laboratory, and that's who would provide you the test results. Basically, you would deploy the device in your home for a couple of days, package it up, ship it off to the laboratory, and they would then provide you a formal report of what the radon concentrations are. Now, with the electronic devices, or if you hire a professional using a continuous monitor, those devices provide results almost immediately. And the person who deploys that test is often the person doing the analysis as well.
Mm-hmm. Thank you. Heidi, sort of related to your story about like how the mud got around your system and everything. The question came in, is a basement sump pump pit a likely source of radon entering the home? For instance, this attendee, their home is like maybe 15 years old, and their radon monitor is still sort of registering some lower levels of radon. Is there a way to like seal the sump pump with some sort of cap that could potentially assist with this?
Required. It's a required component of a ASD system. When you install a vent system or a radon mitigation system, you're also required to seal any large openings to the slab. So the sump would qualify as one of those openings. So we regularly install a sealed cover, obviously removable, so that a person can perform maintenance on their pump. But yeah, that cap is an important component of the system.
Thank you. Thank you. Another question, as for like mitigation, what are the challenges of mitigation on a slab home versus maybe one with a basement? And for instance, this attendee mentioned there's no radiant heat, but there are like vents in the floor.
The vents in the floor can present a challenge, particularly if they are return vents, HVAC return vents, simply because when the HVAC system is active, the return vents are negatively pressurized. And if those vents run below the slab in contact with the soil, there's the potential that negative depressurization or negative pressurization of that pipe can begin to draw soil gas in, and then it's then distributed throughout the home with the HVAC system. Within the industry, we call this radon mining, where we're actually actively mining radon out of the soil and distributing it into a home. Without the consideration of subslab vents, in most slab-on-grade homes, we don't run into any different challenges than we might in a home built over a basement.
Great. And I just want to make sure to repeat this again for everyone as far as like how often to test. I think I remember hearing 2 years. Heidi, you mentioned 6 months. What's a good time to test every year and how often?
I like where the industry's going, if nobody's going to answer that one. I like that we now have what appear to be dependable consumer level electronic devices with the EcoCube and the newer AirThings models and some of these devices, because that allows a person to continually monitor what the radon concentrations are in their home. Because as we discussed earlier, these concentrations can and will change and vary a little bit from season to season. And so having that continuous monitoring is is a nice improvement. So
Thank you. Thank you. Here's another question. So does asthma or like other respiratory issues make you more susceptible to radon?
Dr. Everett might be best at answering that question.
And I am a clinical psychologist and not a medical doctor. I'll state that. But just like health problems from smoking exposure are not limited to cancer, there's pulmonary and cardiac. There is a little bit of data out there associating some health problems with exposure to radon. It's just the research isn't really expansive in that area. I would just think that if you're exposed and you're breathing in things to your lung, you may have some lung related or pulmonary related issues that precede a cancer that you probably are just getting treated for because you're having some symptoms. Um,
Yeah,
I,
I can
that's
speak
about
to
the
that
best I can
too.
say to some of that. Yeah.
Yeah, I know there have been some preliminary studies where they have shown that kids exposed to radon who have asthma do tend to experience more flare-ups. But it's still very preliminary. They can't directly attribute that because that could also be a sign of other things going on in the indoor environment. But with a lot of this work, it's all very preliminary. But it's a good sign that we are starting to look into it and starting to learn more about it.
Thank you. Thank you. Well, I'm so sorry that we didn't get a chance to answer all the questions, but we did address a lot of them. So thank you to all of our panelists. Thank you to everyone in attendance as well. And once again, I'll go ahead and put a link to that virtual sign-in sheet. Thank you for filling that out before you leave today. I know the library and also our partners really appreciate having that feedback from attendees. And as you close your window tonight, there'll be a survey that pops up that asks a few more questions about radon. Rachel, do you want to mention a little bit about those survey and what questions are going to be asked?
Sure. So just some questions for us to get a better understanding of whether the attendees here with us tonight have had their homes tested for radon before, or if you plan on testing your home as a result of tonight's program. Just 4 quick questions. So we would love your feedback if you have a minute to complete that.
Wonderful. Thank you, Rachel. Thank you to all of our panelists. And stay tuned for a follow-up email later this week. Good night, everyone.
Good night, everyone. Thank you.